So let's talk cardiac output. Cardiac output is the main job of the heart. Cardiac output is referring to the heart pumping blood to the rest of the tissues of the body to ensure delivery of oxygen and nutrients and removal of waste. So really, cardiac output is the ultimate when it comes to the cardiovascular system. It's super, super important, right? So doctors and nurses and other medical staff are always worried about cardiac output when they have a patient in the hospital in a cardiac unit, right? How do we measure cardiac output? How do we measure how well the heart is at doing its job, right? Basically, what we're going to do is we're going to measure how much blood per unit of time gets to the tissues of the body, because that's the name of the game, getting the blood to the tissues of the body. How much blood per unit of time gets to the tissues of the body. Cardiac output is going to vary in response to the body's demands. And that just makes sense. When you have a higher demand for oxygen in a tissue, you're going to need the cardiac output to go up, right? So exercise versus rest, different cardiac outputs. Stressful emergencies, excitement versus rest, different cardiac outputs. On the screen here, we can see where most of the blood is when we're at rest. So at rest, 22% of our blood is in our kidneys, which is actually phenomenal if you think about it. 15% is in skeletal muscle, 14% in the brain. But when we have different demands for the body, we're going to change where that blood is located, right? We're going to have more blood going to skeletal muscle and more blood going to the heart itself, right? So we're going to have changes in the cardiac output with changes in demand by the body. All right, so ultimately we want to look at cardiac output. We know that cardiac output is determined by heart rate and stroke volume. We know that stroke volume is affected by afterload, preload, and contractility. Likewise, we know that contractility and heart rate go hand in hand. What affects the one affects the other, right? So the sympathetic nervous system, the parasympathetic nervous system, thyroid hormone, catecholamines, those are going to affect both contractility and heart rate. And we know all of this. So we know what affects cardiac output. So we've already studied all of this. If you want to review on any of this information, you go back and rewatch our video on heart regulation or stroke volume, and both of those will cover these topics. So really quick overview about heart rate and cardiac output. An increase in parasympathetic signaling, so parachute, slow it down, will decrease heart rate and contractility and decrease cardiac output. An increase in sympathetic nervous system signaling, so that's going to be that fight or flight, will increase heart rate and contractility and increase cardiac output. An increase in the hormones catecholamines or thyroid hormone will increase heart rate and increase contractility, right? So that's heart rate, if you will, and contractility. What about stroke volume, right? We know that stroke volume is impacted by preload, afterload, and contractility, right? So what sorts of things are going to affect preload? Increase in blood volume, an increase in exercise. Both of those will increase preload and increase stroke volume, which will increase cardiac output. If we increase afterload, that means it's harder for the heart to push blood into the major arteries. So that's going to decrease our stroke volume and decrease cardiac output. And then we've already said if we increase contractility, we are going to increase cardiac output. Contractility and heart rate go hand in hand. In summary, anything that increases heart rate and stroke volume will increase cardiac output, and anything that decreases heart rate and stroke volume will decrease cardiac output. Except for the very rare occasion when the increase in one balances out a decrease in the other, but we're not going to worry about that. Here we're going to look at some things that affect heart rate and contractility and therefore cardiac output that we haven't really talked about yet. So first, let's take a look at things that can increase cardiac output by increasing heart rate and/or contractility. This includes an increase in body temperature, an increase in strong emotions, like very angry, for example, will increase heart rate, contractility, and cardiac output. And then there's drugs that can increase these things. So like nicotine, caffeine, and other drugs that act as stimulants will increase heart rate, contractility, and cardiac output. On the other hand, there are some things that will decrease heart rate, contractility, and cardiac output, including a decrease in body temperature. Sometimes, like in surgical suites, they might intentionally lower the temperature in order to decrease heart rate and contractility and cardiac output. Also, depressants like opioids, also known as opiates, and tranquilizers, those will decrease cardiac output too. Another thing we haven't looked at in terms of how it affects cardiac output are electrolytes, aka ions or minerals, if you will. So the three main ions or electrolytes that are going to affect cardiac output are calcium, potassium, and sodium. And the way these affect cardiac output can sometimes get pretty complicated, but we're just going to kind of look at a couple scenarios or some like general scenarios, if you will. Starting with calcium. Hypercalcemia is high blood calcium. If your blood calcium levels are above normal, hypercalcemic, then this can increase cardiac output. Because what's going to happen is when those voltage-gated calcium channels open, more calcium will enter into the cardiac muscle cell, and this is due to an increase in the diffusion gradient, and that's going to increase depolarization and enhance action potentials. Hypokalemia means low blood potassium levels, and low blood potassium can very much decrease cardiac output. If we have low blood potassium, that means that our extracellular potassium levels are low. So if we open up potassium ion channels, more potassium will diffuse out of the cardiac muscle cell than normal, causing extreme hyperpolarization, which will decrease or prevent, if you will, action potentials. Clinically, this is the most important electrolyte when it comes to looking at how electrolytes affect cardiac output. Because an imbalance of potassium will affect the heart much faster than calcium or sodium will. Now, when it comes to sodium, both high and low sodium levels can increase cardiac output. And you might think that that sounds impossible, but in reality, there's a lot of complicated stuff going on here. And if we have either too little or too much sodium, hyponatremia or hypernatremia, then what can happen is we can have an imbalance in the electrical and chemical gradient around the heart, and this can impact the action potentials that are needed to occur for cardiac output.